Good morning and welcome, everybody. Welcome to the winter meeting of the Advisory Council on Alzheimer's and Related Dementia, Research, Care, and Services. But let's pause for a few minutes because our hearts are really heavy about California. I lived there for a period of time and I can imagine the devastation. And I know many of us have people and loved ones and people that we know that are either touched by the fires or touched by the poor air quality for some time into the future. So I am Dr. Adrienne Mims. I'm a clinical epidemiologist, a geriatrician, a quality improvement and process improvement specialist. I'm a chief medical officer at Rainmaker Strategic Solutions, and I serve as the chair for this council. We're going to proceed now with introductions of the other council members. First, those in the room, and then we'll go to those who are online. I'm going to start here with Erin.
My name is Erin Long. Good morning. I'm with the Administration for Community Living, and I manage our Alzheimer's portfolio.
Good morning, Fawn Cothran, the National Alliance for Caregiving.
Good morning, Joanne Pike. I am the CEO of the Alzheimer's Association and the chair of the Risk Reduction Subcommittee, and I represent the voluntary health organizations nationwide.
Thank you. Good morning. My name is Tisa Marie Sherry. I'm with the Office of the Assistant Secretary for Planning and Evaluation, or ASPE, at HHS, where I'm the Deputy Assistant Secretary for Behavioral Health, Disability, and Aging Policy, and I'm also performing the duties of the Assistant Secretary.
Good morning, everyone. I'm Helen Lamont. I'm also in ASPE in the Office of Behavioral Health, Disability, and Aging Policy, and I serve as designated federal officer for this advisory.
Good morning. I'm Helen Bundy-Metzger. I am a caregiver representative to the Napa Council and also chair of the Long-Term Services and Support Subcommittee.
Good morning, everyone. I'm Rhonda Williams. I'm with Vermont Department of Health. I am a director in chronic disease prevention and management, and I'm here representing public health.
Hi, I'm Arlene Bierman. I'm the Chief Strategy Officer at the Agency for Healthcare Research and Quality. I'm a geriatrician and health services researcher.
Hello, I'm Dee Cato. I am a provider representative, and I serve as the CEO of AG Roads, a nonprofit group of nursing homes out of Atlanta, Georgia.
Good morning. I'm Maria Teresa O'Caffrey. I'm a representative from ASPE.
Morning, I'm Juan Rodriguez. I'm the chief of the Healthy Aging Branch of the Centers for Disease Control and Prevention. Good morning.
Good morning, Alicia Etheridge, lead of the Alzheimer's Disease Program Team at the Centers for Disease Control and Prevention.
We'll go online now. Ken?
Good morning. My name is Ken Kim. I represent immigrants and refugees.
Thank you. Randall?
Hello, I'm Randy Bateman at Washington University in St. Louis, a neurologist and also chair of the research subcommittee.
Susan?
Good morning. I'm Susan DeMorris. I'm the director of the California Department of Aging and a member of the LTSS subcommittee.
So Walter?
Hi, I'm Walter Koroseth, a neurologist and director of the Neurologic Institute at NIH.
Amy?
Hello, I'm Amy Kelly. I'm Deputy Director at the National Institute on Aging.
Richard?
Richard Hodich, Director of the National Institute on Aging.
Nikhil?
Good morning, everybody. I'm Nikhil Kiros, an associate professor of the Medical School and member of the Research and Clinical Subcommittee.
Ellen?
Hi, I'm Ellen Blackwell with the Centers for Medicare and Medicaid Services. I'm sitting in for Dr. Sherry.
Okay, Ellen, Your microphone, we couldn't hear you that well. Can you?
I'll try to speak a little louder. Is that better?
Yes, that's better.
Yes, I'm Ellen Blackwell with CMS, here for sharing this morning.
Thank you. I hope I have gotten everyone who's on the council. If I've missed you, please speak up now. Thank you. Looking at our agenda today, it is quite full. We're very excited that we're going to have federal updates. We're going to have a presentation on risk reduction and then spend the bulk of the day on long-term services and support. Focusing on NAPA, we have a lot to celebrate. The reauthorization of the National Alzheimer's Project Act is a real milestone for this council and all of the work. It really gives recognition and acknowledgement to the many accomplishments that have occurred. It adds formally 2 additional federal members, Department of Justice and Federal Emergency Management Agency, or FEMA. And when I look at those 2 joining, I really think of the person post-diagnosis well into the disease and the protections that they need. So I'm very excited to have those actually joining us. As we have all received the 2024 National Plan Update and had a deep dive into the 174 pages of it, it's really full of a lot of information and a bookmark to be shared with everybody of all the resources in progress. I was struck with all the progress from the research division and how we have full perspective of research across the spectrum, whether it's on trying to diagnose early, whether it's trying to find biomarkers for all the types of dementia, whether it's looking at other etiologies, whether it's looking at treatment or using other drugs available for types of treatment. We have so much new information that is funded that will then roll out over the next 5 years. I saw that Aaron's group from ACL has been doing an outstanding job supporting the communities and trying to roll out care post-diagnosis. We need more emphasis there. And when I look at risk reduction, it really opened my eyes that for the next 10 years, those people who will be diagnosed with dementia, they're already here sitting among us. And so the importance of focusing in on those who are earlier in stage is an imperative to our country. And so heightening the perspective and resources toward risk reduction is going to be important. So first, I'm going to turn the agenda over to Helen for the federal update.
Thank you so much, Adrian. We are doing federal updates a little bit differently today. We had a short time period and then an exciting announcement from CDC in partnership with the Alzheimer's Association that we really wanted to focus on. So we are doing very short, pithy federal updates, and thanks to our federal partners who have a lot to share, but condensed it down into just a few slides. So if you'll give me a moment to pull the slides up, we're going to go in alphabetical order. We're going to start with HQ, then CMS, IHS, NIH, and going to end with ASPE. And then we're going to turn to our CDC colleagues to tell us about the new roadmap. So 1 second, and then it's over to you.
Are you going to put up the slide? Yeah. So I can just start talking because we're short on time. But we're just going to share one thing today from AHRQ. We had a request from Congress to look at the impact of ageism in healthcare, which I know is relevant to everybody who has, dementia-related illness or at risk for it. And basically, the Congress asked us to look at 3 things. They wanted us to look at the impact of ageism on safety, quality, access, and outcomes of care, as well as equity issues, how it might affect different groups differently. For example, if you're low income, a woman with disabilities, and then also to look at promising solutions. So to begin to gather information, we put a request for information in the Federal Register. The slide has a little bit more background on it. Yeah. Yeah. And so what I want everybody to know, you can read it, you'll have the slides, exactly what we're asking for, but we really want to get a very good, rich response to the request for information. So I just want to ask everybody on the council and everybody who's here today to really think about, do you have something that you want to share with us? And also to circulate it to your network so there's more awareness that we're really interested in this topic.
Thank you, Arlene. Ellen, over to you.
Can you hear me?
Yes, but you're low, so try to speak up.
Okay, I will speak up. There's an issue with my laptop. Sorry. Okay, next slide. I'm going to breeze right through these. This is just a summary of some important finalized services that were in the 2025 position fee schedule. Next slide. And then you'll see in these successive slides, there's more information. If you get a minute, please just go through these. Next slide. Next slide. Also highlight that. And then there are three other things that I just wanted to draw your attention to. The group has been paying attention to CMMI's accountable health communities model, which just issued this final report. Take a look at it. Also, our colleagues over in Medicaid released informational bulletin on how states can cover services related to health-related service, social needs. These are optional services using the HRSN framework in this law. Examples of optional services are states, but last but not least, there are some terrific resources on our resources for integrated care website that are all together. I was looking at it this morning, just a really rich list of items to take a look at. So that is it for CMS.
We also work internally with our.
Thank you, Ellen. Next, we have IHS. And it's Julie. Julie, were you able to join us?
Inclusive, and culturally relevant. And then we also work with our partners at
Okay, we are going to skip over IHS and come back. They are able to join us.
Brainstorming for the toolkit and making sure that it was relevant.
They have. And then we're going to turn it over to NIH. Dr. Hodis, over to you.
Okay, very briefly from Walter Korshess and myself. Next slide, please. In response to congressional language to NIA and NIDS, the National Academies carried out a committee exercise to examine current state of research on prevention and treatment. Report was released just last month. This schematic to the right illustrates the major topics. The next slide shows those in bullet form: to enhance longitudinal research, enable multidisciplinary research, foster inclusive research, increase accessibility of data and samples, and catalyze transformational change. Next slide, please. This is a list of some of the recently published NIH Alzheimer's related dementias funding opportunities. And next slide. To Walter.
Thanks, Richard. Just wanted to mention that our work and Richard's work and NIA very, very closely linked. And our topics that we put out funding for are based on summits that occur on an annual basis in different areas. And wanted to mention that the Alzheimer's disease related dementia summit is coming up in 2025, March 25 to 26. You can see here a list of the topics. And these reflect the different Alzheimer-related dementias. And from these topics, we get recommendations from experts, and that's how we move forward with the research. So look forward to that. A lot of work going on in the background. And next slide. I think that's it.
Hi, everybody. I'm going to be giving ASPE's update. Our main update is that we have been very, very hard at work publishing a large number of reports related to various aspects of care and long-term services and supports for people experiencing and at risk of dementia. And also services addressing the needs of their caregivers. A sampling is up here and includes research looking at the use of inpatient psychiatric facilities by Medicare beneficiaries with dementia, identifying employer supports for caregivers, family caregivers of older adults with a range of conditions, including but not limited to dementia, and also an overview of bereavement and grief services, another very important source of support for loved ones who lose somebody with dementia. In addition, we have a number of work related to also the formal workforce care, paid workforce caring for people with dementia, including a study examining wages of direct care workers, both at the state and the national level compared to other entry-level jobs, as well as a case study of New Jersey's efforts to increase wages for their home care workforce. There are actually going to be more reports coming this week. The team has been very, very hard at work, and a huge thank you to Helen and all our staff for the wonderful research.
And then we missed ACL slides, but we will come back to them. So for now, we're going to turn it over to our CDC colleagues and Joanne. Juan, if you wouldn't mind speaking at the podium, the angle is better there than it is in another spot. So I'm going to turn the floor to you all. You can just say next slides.
Hello? Okay. Good morning. So we are here this morning to give you a short introduction to the new roadmap today. We hope you will register for the launch webinar to hear more from the leadership committee about the development, the final product, and the plans for implementation. The roadmap for American Indian and Alaska Native peoples was released online on December 20th. So just before the holidays, just in time for a stocking stuffer. The official launch webinar will be held on January 22nd. In the first few weeks of this release, there are over 1,600 website views and 290 downloads of the document. Our video has 5,518 views across LinkedIn and YouTube. These are very impressive considering this was released December 20th. I know I was in a mad dash just before the holidays. Okay, next slide. The roadmap is the 6th overall since 2007 and is the 2nd edition of the roadmap specifically for AIAN communities. New in this edition, you'll find a focus on the indigenous determinants of health, inclusive imagery and graphics with 8 different patterns and photos from 6 different photographers in addition to some stock images. One of the best new things in this roadmap are the many examples provided throughout the text and in the communities in action section. There are 12 stories from tribes and other partner organizations working with tribes in Alaskan Native villages. The roadmap for Indian country opened up new funding opportunities and increased awareness about Alzheimer's and dementia in AIAN communities. It has been amazing to see how many examples we had to share in this update. You can see all this on the website, alz.org/public health, or you can click on the banner at the top of cdc.gov/aging-program. Never an easy link. But from here, I'll turn it over to Dr. Pike to talk a little bit more about the development process.
Thank you, Dr. Rodriguez. And I just want to quickly say thank you for the partnership on this work. We're really excited to bring this to life and happy to see that late in December, still considered fall, we were able to bring this to life. So the first edition, when the first edition of the roadmap was published, we didn't realize at the time that it would become a full book, but it certainly became one, and we planned for that this time around. Just very similar to what we've done with the other roadmaps, we utilized a 15-month timeline and a leadership committee. As you can see on the slide, the leadership committee was filled with experts, many familiar names to those of you here in the room. And the committee was chaired by the Alzheimer's Association along with the CDC. So in addition to the leadership committee, we had 9 federal liaisons, many here or online with us today, And I want to quickly thank those NAPA members who were involved in this: Ellen Blackwell, Sarah Fontaine, Melinda Kelly, Helen Lamont, Yen Lin, Sherry Ling, Aaron Long, Rochelle Rollins, and Joan Weiss, and along with other, about 20 other staff and consultants that contributed to the work overall. Next slide. So what you see here is the timeline that we utilized for the build of the roadmap. The process to develop the roadmap officially began in November of 2023 with the first meeting of that leadership committee. They talked about what they wanted for this update, including more diversity of images and examples, more storytelling, and more visuals. What you heard from Dr. Rodriguez at the start. The group felt it was also important to hear from the community of people using the current roadmap. So a series of open meetings, open input sessions were held with different leadership committee members helping to understand what was the feedback that we could take into this new roadmap. In total, we heard from over 200 individuals during those listening sessions or talking circles about the roadmap. The feedback also let us know that the images in the remake of the current state and local roadmap was a very useful but needed to be adapted to center on the American Indian and Alaska Native culture. And so that is what the leadership team really took into our first in-person meeting in March of this past year in Oklahoma City, where they really began to prioritize actions and begin the process of determining what those culturally centered icons and graphics could be as part of this process. And then from there, we began writing and really looking at the revisions to the final project that, like was mentioned, was launched on December 20th. So I'll turn it back over to Dr. Rodriguez for description of the new icons and graphics.
All right, so this wheel should look very familiar. It's the HBI roadmap framework, but it's been adapted to be culturally centered for AIA and communities. It is not technically a traditional medicine wheel, but given the circular shape, the committee and other reviewers felt the straight lines symbolizing the medicine wheel were more representative. The icons are also a little bit different. I'll talk more about those on the next slide, but the framework is really centered around culture being health, which is a pillar of the CDC Tribal Health Program. Next slide. On this slide, you can see at the bottom the meaning of each of the icons. The leadership committee decided to go with nature as a theme. Nature is core to all AIAN cultures, and overall, there was more alignment on meaning of nature symbols as the committee discussed across groups. It was very interesting to hear the committee discuss different meanings of symbols to them and learn from each other. Ultimately, this is the reason for the descriptions. There can be different meanings for many of these symbols, so the committee felt it was important to share why each was chosen. You'll see some subtle differences in wording from the state and local roadmap, like engage communities and share knowledge, to emphasize the importance of two-way knowledge sharing as we implement public health programs in AIAN communities. As we all know, even though so much goes into developing a resource like this, its release is only the beginning. I'll turn it back over to Dr. Pike. We'll share a little bit more about what comes next.
And we are really excited about what comes next. For the first time ever, we are launching an implementation funding opportunity with the release of this roadmap. This program has been adopted from the Roadmap Strategist program, where we have funded 36 local health departments as part of the implementation of the state and local roadmap. We're working with the North Dakota State University American Indian Public Health Resource Center and the Urban Indian Health Institute to ensure the program is useful and impactful for the tribally led organizations that do apply. Applications are now open through February 21st, and we're looking forward to seeing what those applications look like. On the next slide, you will see a QR code. And as we look at ways that individuals can learn about this, you can use this QR code to learn about those application processes and also register for a webinar to hear more about the roadmap from the leadership committee in January. In addition to the roadmap, there's also an executive summary online a one-pager about what's new in the roadmap, and a video that we will get to see that is narrated by Dr. J. Neil Henderson, which gives us a great summary of the importance of the work that you're about to see. So we'll turn it over and close with the video, and hopefully, as we all know, video works. We're gonna play it and then join. We have people online can hear it. I don't think that's the right video. Hey, Helen? Yeah. I'm not sure that's the right video.
Awesome. Well, hello, everyone, and welcome.
There are 574 federally recognized.
All right, I'm sorry, we're not getting audio. It's okay. Crossing the fingers didn't work. We'll come back to it at another point, or make it available online, right? Okay. Thank you all.
Thank you so much.
So thank you very much. We're going to come back to the video shortly. Aaron?
Wait, hold on. Maria's going to pull up Aaron's slides.
We're going to switch back over to Administration for Community Living. Aaron, we'll have you go next.
Thanks for being so flexible.
We appreciate your flexibility. We're going to go back to the video.
There are 574 federally recognized American Indian tribes, nations, pueblos, bands, and Alaska Native villages in the United States, as well as state-recognized tribes and many other communities without federal or state recognition. All have their own history, traditions, cultures, and practices. These strengths build resilience and should be incorporated when planning public health action in these communities. The Healthy Brain Initiative, Roadmap for American Indian and Alaska Native Peoples, offers actions to improve brain health throughout life. It promotes health equity by using a strengths-based approach that honors the diverse American Indian and Alaska Native cultures and incorporates the indigenous social determinants of health. This second edition builds on what was learned from the implementation of the first roadmap and can help public health professionals working with American Indian and Alaska Native communities and urban Indian organizations implement strategies to improve brain health, address dementia, and better meet the needs of caregivers. Through a focus on culture and health, the roadmap offers strategies to engage communities and share knowledge, build a representative and skilled workforce, measure, evaluate, and use data, and strengthen policies and relationships. Public health can help support the culture, customs, and traditions of American Indian and Alaska Native peoples while helping reduce the risk of dementia throughout life.
Thank you very much. We'll now move to Aaron Long.
Thank you for giving me this time. I apologize for being late with my submission. Next slide, please. I just want to give a broad picture of ACL's diverse programs that we have. We have a few funding opportunities coming up. We have a new developing dementia capable community health worker program for the National Aging Network. We're super excited with the prospect of embedding community health worker programs within aging area agencies on aging. And so the competition is limited to just the Aging Network, which is super exciting. We just got our approval last week. We're reviving our dementia capability in Indian Country grant program, which will have two options, one for expansion of our previous grantees, and then another one to engage more tribes and tribal entities to begin their working on ADRD, and then our traditional states and community grants. We also are just continuing our support of the National Alzheimer's Call Center and the innovations in dementia-specific respite, which is more commonly known these days as the Center for Dementia Respite Innovation, CDRI. Next slide, please. Just a quick update to show that programs across ACL are engaging more in ADRD work. For our ACL's Lifespan Respite Care Program, our Colorado Respite Coalition is providing grants to respite providers for no-cost, low-cost respite care and training, giving dementia-specific training to caregivers. And the Delaware Division of Aging Services is collaborating with providers to replicate two respite models, Respite for All, which is a faith-based organization that facilitates opening respite programs in churches, and the musical memory cafes. That's just two examples of the wide variety of lifespan respite programs that are going on. Next slide, please. In the Office of Disabilities, ACL's Office Administration on Disabilities, they're responsible for the University Centers for Excellence in Developmental Disabilities, the UCEDs. Just one example of a UCED that's working on dementia issues is the Eunice Kennedy Shriver Center. They're doing trainings for caregivers, families, direct support professionals, residential managers, and service coordinators, and that's in Massachusetts. Then we also have the state councils on developmental disabilities, and in Arizona or in California, they're serving on Stanford's Alzheimer's, and they're serving people with Alzheimer's and Down syndrome and working to transform Alzheimer's care and through their work group. In Hawaii, the State Council on Developmental Disabilities is working they created a resource guide with the National Task Group, and they also launched a high school internship program to introduce students to career and caregiving and health supportive services as well. And the last example is the Nevada Governor's Council on Developmental Disabilities is providing statewide training for DD and dementia. And the exciting part about that for me is that two ACL community grants have launched that and really led the charge in Nevada to make that happen. And we're very proud of their work. Next slide. Just a couple of things that are coming up. We have a webinar coming up in 2 weeks. It's a little different from our normal format. We have 10 a year. We have a panel of caregivers that is being, they're all people involved in the dementia workforce, but they were caregivers themselves. So it's being facilitated by a caregiver who's working for Caring Kind in New York, and then three other individuals, someone from the absentee Shawnee tribe, and two others that were caregivers in real life and then took that and then are using that as they work in the dementia field. I wanted to call attention to as part of the National Strategy for Caregiving, they funded the National Caregiver Support Coalition grants. And UCSF received a grant to address Goal 2 of the strategy to create caregivers as partners in care teams. And they created a caregiver training billing guide, which really is interesting and will help billers inform them on codes that they can use to pay for caregiver training. And lastly, there's an upcoming conference. It sort of aligns with one of the speakers today on providing trauma-informed care for older adults. There's a conference coming up. ACL funds the Holocaust Survivor Program, and that has really turned into trauma-informed care focus. And they're having a conference later this year that is going to focus on person-centered trauma-informed care services. And there's a obvious connection with people with Alzheimer's and related dementias for that conference. And I think that's my last slide. Thank you.
Thank you, Erin. And I think that conference, the last one you mentioned, is so timely, reflecting back, as we talked about before, the fires in Los Angeles. Some of those people are living with dementia. Some of those are caregivers of people living with dementia. And if the emergency responders have not previously been trained, it would be a challenge in terms of the evacuation, notification, and everything that they need. So hence the Justice Department and FEMA joining this council is going to be essential. Thank you. Today is actually also a farewell. Dr. Tisa Marie Sherry has served as the Deputy Assistant Secretary for Behavioral Health, Disability, and Aging Policy since May of 2021. Prior to coming to ASPE, she was a primary care physician and health policy researcher, primarily with an expertise in behavioral health. She jumped right into the NAPA work, which in the summer of 2021 included a new ad hoc subcommittee that was charged with making recommendations on how to incorporate dementia risk reduction into the national plan. Ultimately, that group recommended a new goal, as we know is goal number 6, to be added to the national plan. But that was not actually an easy lift. We had to make sure there was enough evidence to support the focus on risk reduction, engage federal stakeholders, and then get the support from departmental leadership. It was a lot of steps, not just accept a new goal. To do all that, Tisa carried the water. She helped design the new goal, work with the federal partners to populate it, and she was the one who took that goal to the Secretary Becerra to get his approval and sign off. He was very supportive of the work, and he even did a television spot on MSNBC announcing the new risk reduction goal, and he talked about his own dementia caregiving experience, really putting power to that. Less than 6 months later, in May 2022, we celebrated the 10th anniversary of the national plan. Tisa said, well, this is an opportunity to really lift this up. and talk about all the progress that's been made in Alzheimer's research, care, and services through the national plan. Among many activities that happened that month, HHS created an anniversary website so others can actually join into that. Also, it included a timeline of the achievements. NIH developed videos that reflect the research progress, which there has been many. And there was a webinar that was held with state and local partners to really highlight the importance of the work, and so much more was done. But I want to really focus in that on every opportunity, TISA has tied this NAPA work to other high priority activities that's been going on in the administration, including President Biden's CARE executive orders. And she has advanced priorities like care coordination and caregiver support, and have led important changes like the guide model. Needless to say, she didn't start this work as a dementia expert, but she's leaving as one. Her input and leadership has been invaluable, and we hope that she continues to think of NAPA and our work as she goes through other things in her life. Thank you.
That was incredibly kind, Dr. Mims. Thank you so much. And I think it's incredibly generous to say that I'm leaving as an expert, but I certainly aspire to be. All of the accomplishments you shared are, I think, our collective successes. And so I really want to recognize and thank everybody sitting here around the table, everybody on Zoom, and also just our broader community of dedicated external partners who have worked so closely with us to make all of this possible. Working on as part of this this FACA has been truly one of the highlights and the greatest privileges of my time getting to serve at HHS. And in part, it's because of the wonderful people, the importance of the work, but also I think the work this advisory council has done has just really demonstrated what is possible when the federal government and our external partners all come together around a shared purpose and really work to enact transformative change. And there's so much to be proud of. I came in getting to stand on the shoulders of all of the incredible work that this advisory committee and our federal colleagues have been doing for a decade at this point. And so I'm just very grateful to have had gotten to be a part of it for a brief period of time, and want to thank all of you. To our external partners who are members of the advisory committee, a really big thank you to all of you for your service. We know you're all doing many other things, and I think you really deepen and enrich the work we do so much. And to our federal colleagues, it's been such a privilege to serve with all of you. And there is your expertise and your dedication to serving people with Alzheimer's disease and related dementias, and those in their communities who care for them, who are similarly affected, is just unmatched. I can't thank you enough for all you have taught me. A special thank you to Dr. Mims, who's been an extraordinary chair, and also to my team in ASPE, Maria and Dr. Helen Lamont, who has really led this work since its inception, and who I know is going to carry this group into the next chapter, and you're all going to continue to do amazing things. So thank you so much, and onward.
With that, that's going to take us into our first morning break. We will reconvene at 9:50. Thank you.
Produced by the U.S. Department of Health and Human Services.